All right, so welcome everyone to our annual Practice and Policy webinar. We do this every January, and it's our way of helping to kind of inform all the members of AMSSM who are interested in practice and policy, whether you're on our committee or not, what our committee is up to, what AMSSM members are up to. And this time we decided to assemble a panel of AMSSM members who've been really active at the policy level in their state, in their respective state, doing unique things that we thought would be great for all of us to kind of hear their experiences, get some questions answered, maybe some tips on those of you on the call, on the webinar who are looking for kind of some ideas on how to really get started in working in the policy area and learning some of the I don't know, tips from the experts, so to speak. So we've got four panelists today, and we're going to hear from each of them for about 5 or 10 minutes to talk about their experiences and what they've been able to accomplish in their state. And then we'll kind of open it up for discussion and Q&A. I do know that our first panelist, who I'll introduce in a minute, Jenny Kuntz, does have to jump off right after she describes her work. So we'll probably have a little discussion and Q&A regarding Jenny's work right after she finishes, and then we'll go to the others. So just to go through the order, we're going to start with Dr. Jenny Kuntz, who's working on some policy changes that will make it easier for traveling team physicians to work in Kansas. That's a state where she's active. Then we're going to hear from Dr. Anthony Shadiak, who has created a head trauma coalition that's been working with state legislature in South Carolina. And then we're going to hear from Dr. Chad Carlson, who's very connected in Iowa, and right now has been kind of the epicenter of the presidential primary election. So he's going to give us a little bit of an Iowa overview, but also maybe a national overview of some possible health policy outcomes after the election. And then finally, Dr. Cindy Chang, who's deeply involved in California policies. And I think an interesting one, hopefully she'll talk a little bit about, is one she's working on related to athletic training licensure, and maybe some other issues as well in California. So I'm going to pass it off to Jenny Kuntz to get us started.
Thanks so much. Yeah, it's nice to be on the call and be on this big annual meeting. Sorry, I have to leave right after this. I want to hear everyone, but hopefully I can watch it recorded. But I'm on the NFHS Sports Medicine Advisory Committee, and we have 3 meetings a year, and one of them happens to be going on right now. So I will hop back over there when I'm finished. But Brian asked me to talk a little bit about some state legislation from Kansas, and thought I'd just walk you through maybe the process of how that looked and some cautionary tales and some work left, remaining to be done. So I know a lot of people that are interested in practice and policy already know a lot of really basic things about legislation. It's all about relationships, and it's really nice if you can develop a long-term relationship with not just legislators, but also people that work in certain agencies and government and staffers. And it really does matter who you know and, who you've, had a relationship with when it comes time to advocate for something you want. And and a lot of state legislation is about what has already happened in other states. There's always something that comes, one piece of legislation that comes first, but a lot of state legislation is model legislation templates that have already been passed in other states, and then advocates try to get that model legislation out there into every state and make it happen. And so we've seen that in sports medicine, say with concussion laws. That's exactly what happened there. And then this example is about a traveling team physician, and that's what happened here too. There's still one state that hasn't passed a sports waiver type of bill, I believe Oklahoma. and for those of you not familiar with the issue, like there's this idea that, licensure is a state issue. So if we travel with our team across state lines, are we practicing without a license? Are we protected? It's always been a gray area. So this idea was to pass legislation to protect us. And Kansas and Hawaii both passed legislation last year. As many of you know, there was a huge federal bill passed in 2018 to try to address this issue, but nonetheless, many people view licensure as a state issue. So it's not clear if the federal bill is protective. Kansas Senate Bill 131 was signed into law last year. And this came from an AMSSM member who is not me, that worked to get this passed and basically contacted their legislator and and moved forward. And I'm pretty involved in a lot of different medical organizations, I guess, across our state, professional societies, and actually serve on our Kansas Board of Healing Arts as a board member, and that's the licensure regulation agency in the state of Kansas. So a lot of involved entities, and nobody had really wanted to move forward. And there was always some fear that, if you bring up any health issue, you could tack on something controversial like Medicaid expansion or, whatever it is. So a lot of times what are smaller issues to a lot of people don't get addressed. But this bill got introduced at committee level, and the Board of Healing Arts was going to testify against it because nobody had reached out to them. They didn't even know what was going on. But then Brian got involved and really started working with them, and with some negotiation, it ended up getting passed. And then the Board of Healing Arts writes the regulation. And so it got passed, but it got passed with with some flaws. And so you never know how regulation is going to get written. That's one reason legislative language is, how tight it is, I guess, is so important. But in Kansas, it didn't really get passed as a waiver. Like the ideal legislation would be this passive waiver where, if as long as you're caring just for your sports team that's from your state, you just passively kind of have permission to take care of your team while you're temporarily there. Well, in Kansas, different healthcare providers have to apply in order to get permission, and they're limited to no more than 5 per year. And some different healthcare providers that never asked for this got lumped into the regulations, such as athletic trainers. And it caused a huge uproar because, there are high schools that exist on the border, on the state borders, that just travel back and forth all the time and certainly need a waiver more than 5 times a year. There are, our I would guess we have 3 D1 universities that travel, but KU and K-State are in the Big 12, and the Big 12 physicians and athletic trainers got really upset with this because they might come into the state, more than 5 times a year, and all of that. And so through some work with the Board of Healing Arts, with Brian and I, we were able to, kind of get them to change some of the applications, simplify it, make it easier. They actually decided to make a decision to omit athletic trainers, with the athletic trainers' promise that they were going to address their issue legislatively this legislative session, which is, about to start. And so for now, athletic trainers are off the list, although I will say the Board of Healing Arts views them as, applicable to this. They give them their license, and they are sports medicine clinicians. So I think one important lesson is it's nice to pass legislation, but you want to make sure it's right before that happens, and you want to have those relationships to fix legislation, if that, because no legislation's ever perfect, and it's a cautionary tale that legislative solutions aren't always the best. But I think the goal is to involve all the stakeholder agencies as much as possible. But that is one reason why I never really chose to use political capital, I guess, to get it passed before, because some organizations that have effective lobbyists and are really effective at your state level might choose to block your bill and not want to spend their own political capital on that bill. And so do you kind of wait around and do nothing? Or do you go for it and then let people kind of fix it on the back end? And so, if there is somebody, if if you're advocating for something in your state, there's a barrier to getting that done, you kind of have to choose, like, can I bridge this and can we work it out, or do I need to bypass them? And at some point that becomes a decision to make. So this year we have some work to do, in the legislation to make that easier. And it would be ideal if it could be a true passive waiver. And I think because, KU and K-State are very popular entities, and I think there'll be a lot of support for legislators involved to kind of fix, a lot of legislators to fix this issue to make it easier. So I'm hopeful we can kind of work through it and, continue to keep everyone's safety at the forefront of it all. So, yeah, so I think that's mainly what I wanted to say. I don't know if anyone has any questions about it.
I have a question, Jenny.
Yeah.
You told me that you told us that there was someone else who had kind of initiated this bill.
Yeah.
And then did you guys do a handoff, or were you both involved then, or how did you get more involved in it with, or is it because you were closer to the AMSSM?
No,
With
Brian connected pretty much all the AMSSM members in Kansas to let them know that this was about to be heard at committee. And that's how I found out about it. Yeah.
Okay.
Because he was looking for our support and possible testimony and to sign on to a letter of support and things like that. So yeah, but it was kind of tricky with my role at the Board of Healing Arts. It was kind of tricky, like just conflicts of interest and, but I just, being a part of that board, like, I was like, oh no, like, this is not going to work. So, but it's hard. Like, most people don't even think about something like that, like, who's writing the regulation and what do they think, about all of this? And it's clearly not the top of their priority. They didn't even know there was an issue, so it's been good. They've been wonderful to work with. They've been great for Brian. Brian and them have developed a relationship and they've been really supportive. They're trying to do their best to make it easy within the confines of the legislative or the statute language.
Hey, Dr. Coons may just be too humble, but she's really integral in making sure that this process didn't turn into a catastrophe. There were some irate physicians in the conference and so forth, and she was open to hearing their concerns and helping us through her position on the Board of Healing Arts to smooth as much as we could within the bounds of the legislation, smooth some of that to make it as easy as possible for traveling team physicians coming to Kansas. So thank you many times over to Dr. Coons for helping us out there and all the work that she's doing there in Kansas.
Thank you, Brian. Thanks for all your help.
I have a quick question
Yeah.
before you run off to the other SMAC meeting. So with the federal law being having passed in 2018, and now you're saying a couple of states are now passing state laws, is there?
Sorry, all the states have passed a state law except Oklahoma. So 49 states. Yeah.
Okay.
Sorry, but go ahead, Neha. Like, I didn't mean to interrupt. I just wanted to.
No, that's perfectly right. That's perfectly
Okay.
okay. I was going to ask, is there a space for states to be more proactive in putting something on their books? But if they've already done it, then
Yeah.
no. So thank
We
you.
were one of the last. Yeah.
Oh, that's okay.
Thanks, Jenny. Thanks for the good work and just a description of this process. I just want to underscore, like, reading the bills and knowing the legislation, like, these are not written by physicians, even if they're for medical things. So, they might say something like cardiovascular screening. Well, that could mean a number of different things. So I think that's really important when, you're engaging with legislators, that you kind of know what they're writing down and what that means practically.
Yeah, thanks. That's a great point, Sarah.
Yeah, thanks so much, Jenny. I mean, yeah, you're a champ. I don't know what would have happened if you weren't on the board. I mean, they were lucky to have you to represent sports medicine.
Yes,
I mean, I think,
yes, this is good that I was there.
yeah, yeah. But I think too, what I heard and what I learned from what you described is, it's really a value to have all the players' input from the get-go when you start writing the bill, to understand what everybody's concerned and to have them feel like you didn't write it and then ask their opinion, that you asked them to contribute and be part of the process from the beginning. Because I feel like then And I've had a similar situation where then you're kind of backpedaling because they feel like, well, we're going to dig our heels in just because we weren't asked
Mhm.
at the beginning, right? So when
Right,
you're
hurt feelings.
getting started, reaching out to all the potential stakeholders, like you pointed out, what would have been is a good
Yeah.
way to go.
It's tricky, you know, like in Kansas, our medical society is a very strong advocacy organization for physicians. I don't know if that's true in every state, but you know, if they're not interested, it's kind of hard to get stuff, you know, passed. And so and we are a smaller group of physicians than, you know, most physician issues. So it is hard to know what to do when you don't have, I don't want to say they were against it, but when you don't have their support, it's kind of like, you know, do you wait for that great opportunity? But yeah, it's always, I agree with you, Cynthia, always good to get all the stakeholders involved and at least hear their issues.
Well, thanks again. We'll let you run off to wear your other hat tonight.
Yeah, thank you guys so much. Great to see you all.
Yep. Take care. All right, we'll go from Kansas to South Carolina. Anthony, you're up.
Well, good evening, everybody. Thank you so much for giving me the time to share my experience with the Concussion Coalition. A bit of background. So back in 2020, I started to do some work with the Brain Injury Association of South Carolina. They had a safety net task force. Part of that task force was to really just help with improving understanding of concussion best practices in South Carolina, to share that sort of best practices. And then in 2022, one other individual and myself at my local hospital, we really wanted to push for improved concussion care in our own hospital, in our community, and we, you know, also some bigger goals of maybe introducing a new bill. South Carolina was, I think, the last state to have a concussion bill or concussion law, if not the last, one of the last states. And so, but at this point, it's been roughly 10 years and at a date, and there's a lot of other more progressive things going on in a variety of other states. And so we really wanted to champion something better. And so some of what Dr. LaBella and Dr. Kuntz were talking about with getting all the key stakeholders on board was something that we wanted to do. And so by ourselves, myself and one other individual and a group of individuals that we sort of started, reached out to a local House of Representative member, Thomas Britton, to move this forward. And it was just things that basically we had come up with. But then towards the end of 2022, we sort of joined our forces with the Brain Injury Association of South Carolina, and we created the Brain Injury Association of South Carolina's Legislative Advocacy Subcommittee, where we met specifically to get all the key stakeholders involved and get everybody's opinion and design something together. And it's been, you know, a process of, you know, we had a number of individuals in our first sort of group, and then sort of people scattered and disappeared. And it's been going in waves like that for a number of years. So now, most recently at the end of 2023, we expanded this advocacy subcommittee and have many more individuals on this, including many that have prior experience with legislation. I think that's going to be a key to our success. Before it was just, you know, passionate individuals, but we didn't have any experience in any of this. And so now there's a number of individuals that have had this prior experience. And so we have individuals from the South Carolina Athletic Trainers Association, including the president, Amy Fraley, and the executive director of the Children's Hospital Collaborative, Maggie Cash, myself and another primary care sports medicine physician, Dr. Holloway, who's also the Prisma Health Pediatric Concussion Clinic medical director. And then some individuals that had firsthand experience in crafting the original bill back some roughly 10 years ago, including Joyce Davis. And so we now have a number of individuals on this team. And although we've been here before many times over the past several years with different groups of individuals, we're again trying to get everybody on board with what is the common language that we can all agree on before we bring it to a senator. And so we're working on that and should have something in this next month that we all agree on is what our goal was. And then with that, what our plan is to have this bill introduced in this legislative session, which goes up until April of this year. And then we plan on using the summer to refine it before we present it again in the next 2-year legislative session, January 2025. And we have identified a senator that we think is maybe willing to champion our bill. As she also works on the Joint Legislative Committee for Children. And so we're working on also developing some talking points in order to present this up to senators on our legislative day in February. And that's basically been our experience up to this point, and it's been an exciting process. And but I agree with Dr. Labella. You need getting everybody on board in the beginning, and not saying like, okay, here's what I want to happen and do it, because it develops hurt feelings, and especially when working with individuals that have had experiences on the original bill as well. It's almost like, you know, we spent a lot of time on this, and here you want to come in and change some things, but this is perfect. It's like, well, you know, it's great, but there's things that could be better. And so, but I think it would have been a smoother experience if we got everybody involved in the very beginning. And so that was definitely something that I would encourage everyone to do. But at the time, as somebody who's just passionate about the topic with no legislative experience, you know, I was just sort of, you know, walking into walls and just sort of like, okay, this is a brick wall, I'm going to move around this wall. And okay, I ran into something. And so I didn't even know really where to go initially. You know, so I would encourage anyone interested in advocacy to reach out to other AMSSM members that have had experience with this, to see, you know, who would be a good idea to reach out to see if, you know, you could develop your own sort of coalition. And I'll keep you guys all informed as we go forward. Anybody have any questions?
I had a question, Anthony, about how you went about identifying the senator to sponsor this. And how you kind of navigated that.
And so it was at one of our meetings recently that one of the other primary care sports medicine physicians had just reached out to this individual in speaking with other legislatures. So how he came across this individual, I'm not exactly certain how she was identified, but everybody agreed that she would be a really good one. As Senator Shealy and she again is she works on the Joint Legislative Committee for Children, and apparently is very passionate about these sort of topics. So it was really identifying someone that's on the correct sort of committee, legislative committee, and so I think that's how they wound up doing it.
Thank you so much for sharing. It's so helpful to hear about your path so far. One thing I was interested in hearing about is how you made those connections to the stakeholders, because I feel like that could probably be daunting when you kind of think about something that you're interested in, trying to make those connections early on.
So the most beneficial route was through the Brain Injury Association, who they had those things established already. Initially, it was just myself and another individual. And we were just passionate about the topic. And she was, the other individual in our group was neighbors with someone who knew the House of Representative member. And it was that sort of way. We didn't get that far. It was fun. We had many conversations and in-person meetings, and it was cool. And, you know, I thought the steam was good and that something would happen with it, and then it sort of just didn't happen. But it was working with the Brain Injury Association and all these individuals, one of whom, you know, helped develop the first bill, in all their contacts. And so it's really finding, you know, these groups who are already doing it, and just joining forces with them.
Thank you.
Well, definitely keep us posted, Anthony. This is good stuff.
Yeah, no, it's been a lot of fun so far, and I have a lot of hope that this is going to turn into something this time around.
Yeah, we're pulling for you. And South Carolina.
Thank you.
All right, so we can shift over to Iowa next. Welcome, Chad. Hopefully we give you enough time here. Do you have to jump off also?
No, but I do want to respect time. Can you hear me? Because I'm on
Okay.
my phone because my computer wasn't working. So you can hear? Okay.
Perfect.
All right. Well, so I was asked to just sort of overview what we're doing in Iowa and then maybe just put a few comments in terms of what I saw as national issues of merit. So just piggybacking on what a couple other people have said real quick, though, I think, you know, when you're trying to get to the right stakeholders in your own state, I think one of the most important things you can do as a physician is to be a member of your state and county medical societies, because those organizations are always going to have lobby presence in the Capitol, and they're going to know people. So, and the other thing is that there's usually a process that you can engage with that will, if you do it the right way, bring the weight of, your state medical society to bear on your issue too, because that's essentially a, organization that exists to promote the issues of doctors, and most doctors aren't that engaged. So, there are more generic issues that every physician, regardless of specialty, is going to be interested in. And obviously they're going to usually, put most of their time and effort into that. For instance, in Iowa last year, tort reform was, passed. And so that was a big deal. It was about a 5-year process. But there, in Iowa, there is a procedure called the Policy Forum for the Iowa Medical Society, where any physician that's a member can put an issue before the Policy Forum and let it go through the process and be formally adopted or rejected. And that's a nice way to test whether your issue has traction, and also get help with your issue if you need it. So, every state's going to have a slightly different means of incorporating the interests of members in, but find out what yours are. And I can't emphasize it enough. You really ought to be a member of your state society if you're interested in advocacy. The other thing to really quickly say is, if the bill that you're trying to propose, like concussion, is an issue that has cross appeal, it's always good to get dual sponsors from both parties, so that it's bipartisan from the beginning. Here in Iowa this year, because we passed tort reform last year, I guess it's more of a quiet year for the medical society. The biggest issue really for us this year is not really legislative, but Iowa does not have a SMAC. So we're a little bit weird because there's a separate boys and girls high school union. They're not the same organization. So they all have their own rules. And so you'd really almost need 2 SMACs for each union. So what we've had up to this point is there's a sports medicine advisory committee through the medical society, and the unions have a seat at that. And so that's where we discuss issues. We don't discuss them very often, and it's purely advisory. But the cards have just aligned the stars have just aligned so that this year both unions are interested in forming a SMAC that could be a dual SMAC. So that, the organizational meetings with NFHS are going to occur in March. So that's taking up most of our time. We do have a policy reform or policy forum issue on insurance reform, which is, again, more of a generic issue, but it's germane to every physician that bills. And so, this is just designed to allow us to increase the efficiency for staff on their interactions with insurers, because, and I know because I've had to do this myself running a practice, but you can be on the phone for 3 hours just to answer a question with Blue Cross. And so simple things like requiring a insurer to provide you a callback option, just like the airline would if you tried to call, you know, there was going to be a long wait to get to a reservation agent. Most companies don't do that, but they ought to. Things like providing an ombudsman through the Iowa Insurance Division so that physicians who feel like they're dealing with contractual issues with insurers with non-payment and stuff like that, that they have somebody to go to, because right now in Iowa, practices can't be represented. So stuff like that, you know, stuff that some of which can be addressed with conversations with the Iowa Insurance Division outside of legislation, and then some of it will, you know, the medical society will, we've got a task force right now with stakeholders. Again, you want to pull as many people as you can in, find the problems that people are having, and then come together and cobble something that could be sponsored into, in this case, the 2025 legislative session. So we're working on that right now. There is a bill in the legislature right now that's got one sponsor right now, so it's not necessarily has traction, but it's a cardiac risk reduction bill that I had nothing to do with. It's again another example, one of these things just pops up. But the bill would require development of a pamphlet and then a training module based on the PPE monograph with the cardiac, you know, screening questions. And the reason I raise it is just because the committee that would put this stuff together, they have representatives, you know, from say the Iowa Academy of Physicians and the Iowa chapter of the American Academy of Pediatrics. But and even though the AMSSM is in the language of the bill because they're on the monograph, but of course there's no requirement for representation from sports medicine in there. And I just think just something to think about, and we, you know, and I just throw it out, is that even if it was just on paper only, having an Iowa association or a South Carolina association of members that's just names and contacts, so that you can come back to the legislature and say, hey, when you're, you know, when you've got an issue of merit with sports medicine that you want stakeholders for, keep us in mind, because really, you know, somebody from the organization ought to be named on that. So, and then again, I just want to be respectful of time. So as far as national issues go, you know, I mean, this is as polarized as the country's ever been. And so I think what you're going to see, no matter who wins the election in the fall, is that most policy change, at least initially, will be through executive order, which means that there's a ping pong effect every time the party changes. And, you know, we operate under one set of administrative rules in one administration and then another one in another. And part of that is because so much policy is actually occurring now through executive rulemaking. And so if I had to focus on two things just to get you thinking, I think the most important thing that might affect healthcare this year would be there's a case before the Supreme Court, oral arguments were just heard on it this week, called the Chevron case. I don't know if you've heard of that or seen it in the news, but the Chevron cases that refers to how courts review an agency's interpretation of a statute that it administers. So, you know, in healthcare, that would be HHS. And interpretation of these statutes currently falls to these agencies. And as long as courts interpret their interpretation as reasonable, they'll let it go. And this causes controversy because, I mean, in our system, the legislative branch is supposed to create the law. The executive branch enforces it, and the judicial branch interprets it. But with executive departments and rulemaking, all three functions occur under the same department. So you'll get a law that's relatively vague in terms of legislative language, and then again, with the case of HHS looks at that and they go into the rulemaking process, and that is open to public feedback, but ultimately they're creating the rule that they're enforcing, and they're also interpreting it. And so this is, you know, the way that this has been, the Chevron case was the case 40 years ago that started this process of judicial leniency for these departments. And so obviously there's a lot of rules that have rulemaking that's occurred over that time. And so now, because of the constitutional implications with this is before the court. Now, if the court reverses this, it would limit the ping pong effect of different rules for different administrations, because it would be harder to change. The executive branches wouldn't have the same leeway to create some of these rules, and really have far-reaching consequences across regulated industries like healthcare. And it would be much easier to challenge HHS rulings as improper. The American Medical Association, I think, ultimately would probably like that. But that's a vitally important case. It's going to have a lot of implications for healthcare in ways that you don't really grasp. That's something to keep your eye on. The other thing that I want to say is that sometimes just the economics of policy are going to start to drive changes that we're not necessarily thinking about either. And the one example that I would give to you for that is just the size of subsidies that are currently being paid for with the Affordable Care Act. So, 2023, it was $1.8 trillion of subsidies, and it's projected to be about $3.3 trillion by 2033, which would be about 8.3% of GDP. So without getting into, any kind of value judgment about that, I would just say that the size of the chunk of the budget that is continuing to take up is going to start to affect, how we administer healthcare in this country. So, when you're reading the news, those are the kinds of things to keep up on, and I think that they're going to affect federal decisions in healthcare much more than what any one administration decides to do right now for 4 years. I don't know if that's helpful, but I think it's reality. Oh, one other quick thing. In Iowa last year, they did pass a bill that allowed physical therapists to order diagnostic imaging. So now PTs can order MRIs, and of course, that affects us in some ways, because what usually happens there is the therapists will order the study and then they just get the report back and they don't really look at it. And so they're sending lots of patients to the surgeon without, I think, due vetting. And so the cat's out of the bag there. And, so our approach to this is actually to just start to try to educate physical therapists about the things that they need to be thinking about when they order these, and what they should be looking at when they hopefully are looking at their own studies. But I don't know if there's similar efforts in other states, but that's something to keep your eye on.
Well, all that's super interesting. Thanks for sharing all those details. Wow. A lot to think about.
Chad, can I ask a quick question about your last comment, if that's okay? Sure. Are you then liable if they order that study? And what if you don't see that study, but it's out there somewhere in?
Well, if they were working under me, I would be, but they would never do that, because I mean, in our practice, that would never happen. But physical therapists don't work under the authority of a physician. They're not like a nurse. Well, in some states now, they're not like an athletic trainer. Athletic trainers in every state work under the authority of a licensed physician, but that's not the case with PT. It's an independent it's an independent clinician. So, no.
Thank you.
You're welcome.
So they carry their own liability if something gets if they don't read the report and it contains something that needed to be acted on right away, for instance.
Yeah,
the PT
malpractice.
Yeah,
I think malpractice premium rates haven't caught up with that yet. But yes, the more autonomous these paraprofessionals become, they'll see their malpractice premiums rise.
Well, thanks again, Chad. I want to make sure we have enough time for Cindy, because I know she has a lot to share with us too. Oh, here we go.
Not that much, but this actually makes it easier for me. Hi, everyone. So I'm Cindy Chang. Chad, thank you so much. For those of you who don't know, Chad started the committee. I'm just going to tell you that. Thank you, Chad. Okay, so there's three things I want to talk about. There's a little bit of overlap with some other things, but maybe just some tips that would be helpful for all of you that are thinking about getting more involved, or how much to get involved. We'll put it that way. So there's three things we're going to talk about. We'll go through it. Okay, the first is the youth tackle football bill, and this was introduced by McCarty, Assembly member. Currently, we have in place, where many states do, right? We're limiting the amount of full contact practices per week. And the same thing with youth tackle during the preseason and during the season, only 2 full contact practices, only 30 minutes max, and it's banned out of season. So McCarty introduced a bill. He basically, I got sent it, and this is the wonderful relationship. And I heard that what Chad was saying, they don't have a interscholastic federation. So we do in California, called the California Interscholastic Federation. I'm a member of the Sports Medicine Advisory Committee, or the SMAC, and it was sent to me as an FYI about this bill. So what happens is that McCarty put this through to be heard in assembly, and it always has to be heard at committee level. So it doesn't get voted on right away. It has to pass certain committees. And essentially it was banned tackle football for people, children less than 12. And actually, if you read through the whole bill, they cite Chris Nowinski, they cite BU, they cite CTE articles, they cite the New York Times. It's pretty crazy. And then they actually have some articles that are at journals and et cetera. So, but they, and they cited the concussion movie. I mean, in this law, this goes back to who's writing the law. I know exactly who's writing the law. I'll tell you about that person. But so amendments got put in place after being heard, and they decided to phase it in over 3 years. They thought it'd be more palatable to people if they started with banning less than 6, then 10, then 12. And so it would be 2029 before the law would be passed. And this passed the Arts, Entertainment, Sports, and Tourism Committee. And this being I don't know if you guys know about, the whole country is a little bit fractured in terms of, don't be our parents and et cetera, et cetera. The governor announced that he would veto it. And after he announced that he would veto it, and the reason he said was because he wanted to leave it up to parents to decide what they thought was best for their kids. But the second thing was that he felt like there wasn't enough time to really evaluate if we had done a better job by reducing the full contact practices, right? Which made sense. So because he said he was going to veto it if it came to his desk, because we are very heavily Democratic in our state, not that this was introduced. I mean, McCarty played football and he's a Democrat. The bill was pulled from consideration. So let me just jump to this bill. So this bill was the athletic trainer licensure bill. I will tell you that the person who was sponsoring the McCarty bill called me months because as he was writing this bill, and he said, we'd like you to support McCarty's bill. And I said, well, send me the language and let me read it. And I'd love to take a look at it. Have you considered this, opportunities, et cetera? And then I said, well, I sure hope that McCarty signs on and works with Dr. Weber. She's an OBGYN who proposed this bill. I sure hope he works with her and he actually, lobbies heavily or talks to his other colleagues about supporting the athletic trainer licensure bill. Well, wouldn't you know, I'm sitting there and I'm at the Business and Professions Committee testifying. McCarty is part of that committee and he doesn't show up. And I clearly said to them, this is a health and safety issue. If you're really committed to health and safety and protecting health and safety for our children, then you should sponsor the athletic trainer licensure bill, because it's all about taking care of our kids and making sure there's a healthcare professional there at their games, on the sideline, et cetera. He doesn't show up. So this is what's frustrating about politics, right? The other thing is it was amended to a registration title protection bill. So no longer licensure. We're the only state in the country that doesn't license athletic trainers. 49 states in the DC District of Columbia have a licensure or registration. Most of it are licensure. How this hurts the athletic trainers is that every single law that's written in place talks about a licensed healthcare provider diagnosing concussions, a licensed healthcare provider evaluating, or bringing them back to return to play policy guidelines. And they don't qualify for any of that because they're not licensed in our state. I want to point out who testified. When you bring a bill before your state, they don't listen to you. I'm sorry to tell you this. It doesn't matter that you're a physician. I had just come back for the Olympics in 2012, testifying on a previous athletic trainer licensure bill, and I had on my jacket with the Olympic thing on it, and I thought, wow, I had on my ring, not that they could see it. And you know what? As I started to testify, they got off their phones. And I wanted to say, do you tell your kids to do that at the dinner table? But they had already been, they're not going to listen. Well, they listened to Rob Need, because Rob is the team physician for Golden State Warriors. Kelsey Stringer, very compelling. Her husband, Corey Stringer, died of heat stroke, and she started the Corey Stringer Institute at UConn, and Doug Casa runs that. Reggie Scott, athletic trainer for the Rams, was there, and we had a lot of support, including with the AMSSM for the bill and NFHS. The people who opposed it were PTs. The PAs opposed it, the PTs opposed it, the OTs opposed it, the union, nurses union opposed it because of fear of athletic trainers taking away their scope of practice bills, et cetera. So it passed through the assembly. Now it has to pass on the other side, which is the Senate. And because of the calendar and stuff, it won't be till June where we testify to try to get it passed. Now I know it's registration title protection, but it's a baby step, right? And if we can get that, then maybe we work on athletic trainer. I want to this is the impact. I already talked about that. I want to know that in my role as a CMO for the National Women's Soccer League, we are very careful because we have 3 teams in the National Women's Soccer League that are in California. So if we use any language in the collective bargaining agreement, if we use any language in the manual, we can't use licensed because that would disqualify the athletic trainers that are working with our teams there. So the language is important when you use it, whenever you're writing up a bill. And again, as much as you can, be involved in the writing of the bill. We're lucky we have a good relationship with CIF, and they're right in Sacramento, so they let us know when these bills are being passed. I gave a lecture to DPT students today at UCSF, and I will tell you, one of the questions was, I really wanted to get involved with athletes, but I started looking into it, and it just seemed like we're unable to do it because it seems like athletic trainers, they're the ones that are with teams, and PTs can't get in with teams. And boy, did that just open the floodgates. It was almost like, oh, you really want to hear about what's going on and why this is an issue? And in the end, I talked to them. I said, you need to talk to your APTA and your CPTA and just say, stop working against athletic trainers. If you want your goals to be more involved in sports, right now, you are not engendering trust at all because you are opposing their licensure. So you need to work together to achieve common goals if that's what you want to do. And this is a theme that's been discussed this hour has been, get people on board, work together, talk first, and work together and make sure that you get your goals achieved. And it may be where you just start bringing people into the conversation right away. Last thing, I know I'm talking fast, but I didn't have much time left. Smart Heart Sports Coalition, just briefly about this, how you can get involved on a bigger level. So most of us heard about, if we didn't see, Damar Hamlin's collapse of commotio cordis on Monday Night Football on national TV. So months later, there was an email announcement, and it came into my email because I'm on the NFL email, and it came from Dr. Sills, Alan Sills, all right? And it basically was announcing that, wow, we have all gotten together to start a coalition called the Smart Heart Sports Coalition, where it is our goal to make sure that 3 best practice policies are adopted by every state in our country. So these are all things that we have in California. EAPs, updated annually, rehearsed, clearly marked AEDs at each athletic venue or within 1 to 3 minutes, and mandatory CPR AED education for coaches. Okay, that's a goal of the Smart Hearts Coalition. But what drew my eye is these were the 5 leagues that were represented, professional leagues. Now, I just told you I am with the NWSL, and it is, for many other reasons, I was huffed about this, right? And I know that sudden cardiac arrest doesn't affect women as much as men, et cetera, et cetera. I'm also a board member for KSI, and I'm like, wow, who knew about this? So I went ahead and I contacted, for those of you who know me, this is not surprising, of course, but I contacted all the CMOs, and I sent them emails, and I sent an email to DaCosta, and I said, hey, are you guys aware of this? And as you were forming the Smart Heart Coalition, I would ask that you consider your colleagues in the NWSL and the WNBA, because we, although we don't have sudden cardiac arrest as much, we can get the message out as well. We're 50% of the population, right? And you want states to adopt this for the high schools, because this is really a high school type of thing, so we can help. Alan Sills, actually, this is eye-opening. Even though the email came from him under his name, he was not aware of it. And essentially, it came through the NFL's Government Affairs and Public Policy. Now, in our league, we're 11 years, we don't have any of this stuff. We have, me. And he contacted me because Alan said, I'll send your email to Ken Edmonds. And Ken Edmonds basically said, okay, well, all right, yes, we should involve you, but, we want active partners, blah, 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 blah. And I said, okay, well, we can be an active partner. So as this was happening, I contacted Brian and AMSSM, and I said, hey, you guys should join, we should join as coalition partners. And so Ken wanted to delay and wait until National CPR and AD Awareness Week. It's all about PR, by the way, right? It's not all about PR, but it's a big thing, right? The NFL and a lot of people want to just say, look at things we're doing. And so we were added, NWSL and the WNBA and the Women's Tennis Association and the USTA, because I started just telling people, and AMSSM was added as coalition partners. So look, we're fourth. If you go on the website and you put in Smart Heart Sports Coalition and you go to the bottom for partners, based on alphabet, we are fourth on there. So hooray. This is where they are right now with their policy advocacy. And again, California meets it, right? But there's definitely states here that don't have these policies enacted. So one of the things that I think that we can do as AMSSM members, and if you're in your state and you're like, we need to have these policies passed, how do I do this? This is where then, because you're part of the AMSSM, and AMSSM is part of the Smart Heart Sports Coalition, and Brian attends every meeting, and I try to attend when I can. I'm the only CMO that does attend. But when you are on this, because we're part of it, we can try to get the NFL to work with us and help us with the funding. So what they've been trying to do is they've been trying to get in front of the legislators at the state level in the capitals and bringing people in, football players, et cetera, to try to get the bill passed. So this is another example of how you try to work together and to try to get something passed in your state. And having the NFL and some of these other heavy hitters behind you is important. So even though California passed, that involves me because I'm in the state, but we have 14 teams, right? And so I look at Utah. I mean, I look at some of the other states of where we don't have all the policies. Florida, we have an Orlando team, for example. And I look at them and I go, okay, you know what we need to do? We need to work within those states. Because I don't want to be a silent partner, because that, I don't like when people sign up and they don't do anything per se. At our recent championship game in San Diego, at our fan fest, I went ahead and collaborated and got some of the other members of this coalition and some members outside the coalition to set up a couple booths, and we did a CPR jukebox and we gave out information. And we, there were like 13,000 people came through the Fan Fest, and we were able to at least get some of the message across about the importance of learning CPR, learning how to use an AED, and the importance of recognizing sudden cardiac arrest. So that's another thing that you guys can do. And, I was able to get, NWCL did not charge us for the booth. And at the time of our fair, you can see there's not even a logo. They do now have a logo for the Smart Heart Sports Coalition. It's been a year, but we finally have a logo. But anyway, the contacts that I've made through doing this will be helpful with other things that hopefully that you'll want to do in the future in terms of policy. And that is it. Stop share. Sorry, talk fast.
No, that was fabulous. Thank you for that.
Anyway.
That was awesome. Congratulations on
Sure,
everything
it's-
you're doing. It's
Yeah,
so
yeah.
great.
I know I'm
just,
exhausted for you just thinking about all that.
I do think that, I'll just emphasize one last point. When you guys are giving lectures, because we're always asked to give lectures, right? So anytime we're giving a lecture and it involves something that has to do with health and safety or policy or anything like that, and you're involving or conversations about the medical team or the sports medicine team and things like that, it's perfect time to talk about issues that maybe are confronting our country nationally or state in the state. And the more awareness that we can promote, the better, right? So, you know, if you're going to talk about cardiac issues in athletes, finish your talk with the fact that you're a member of AMSSM and we are a member of the Smart Heart Sports Coalition. And this is one of the things that we're doing. I mean, because in the end, you know, we talk about community and being part of your community and helping, and we all do it different ways. But some people, they like that policy side of it. They like that political side of it, you know, and maybe that is what's going to be their passion outside of medicine, is that part of it, especially for those of us who have studied, you know, has an MPH or, you know, a master's in public policy or something like that.
Cindy, does the Smart Heart Coalition have set slide decks to bring to school districts?
Lauren, no, we barely just got a logo. I'm trying to, so the interesting thing is this is why I'm saying it was set up as a response because the NFL is like, we got to do something about Damar Hamlin, right? And I would just tell you, Ken has done, I mean, Brian can, you know, Ken's, you know, done a good job leading, but in terms of the funding and the resources that are given to the Smart Heart Sports Coalition, the initial logo design that was passed out to the committee was something that a second grader could have done. I mean, Brian, you know what I'm talking about. Did you vote on that? I mean, I was trying to be nice when I was giving the feedback, but it was so unprofessional. And think about the stuff that comes out of the NFL. It is sweet stuff, right? I mean, it is professional. They couldn't have anyone professional work on a logo for this coalition that was so important. So finally, you know what? The NATA said, we'll take our marketing people and we'll make the logo. Yeah. And they made the logo, which is not NFL level, but it's good. You know what I mean? Like, it's good. It's definitely good, but it's not what, you know, it's not what Ken wanted us to vote on and adopt. You know, he wanted us to vote on 3 styles, and I was like, I would vote for none of them. And these are the reasons why. So anyway. But we might as well take advantage of what they have, you know, and the other partners to try to, and especially, again, if you're in a state that you want to get these 3 laws passed, you know, I would say talk to Brian, and in terms of how can we then get it going on. They have priorities. They had priority states. So top priority states, I think there were 12 of them or something, Brian, or 10 of them to get laws passed: Ohio, Michigan, and then, yeah. And obviously the lower population states is lower on their priority, or where they don't have an NFL team is lower on their priority.
I think it's
That
a little
map
bit
is
of
a
a,
nice visual that could be used. You know, Brian, you always have that nice booth set up at the annual meeting for members to stop in who are interested in getting active. And if that could be on display, and, you know, you could say, are you from any of these states that aren't green? This would be a way to start being active in your state and trying to get these policies passed.
Good idea.
I think it's a nice example. We had 4 great speakers who talked about how you really build partnerships and coalitions and be successful. And I think the last one is an example of how honestly not to go about it. Cindy sort of showed some examples of it in that you don't think about all your stakeholders. It's run by the PR arm of things and not the actual medical arm of things. And I had that same conversation with Alan probably the very next day when that map came out because it's completely wrong in several states, which blew up within several stakeholders of who we would need to work with. And as soon as it came out, again, KSI, what the heck are you doing to us? And again, great work, great people, but again, sometimes shoving things down throats. And it's a great cause and it's a great mission, but I think it's one of those things that if it didn't have the shield and some of those other fancy logos behind it, I honestly think it probably would have crashed because it wasn't built the right way compared to the other 4 programs that y'all described. So I think that's a good cautionary tale of how to approach when you're doing these advocacy efforts and really truly involving your stakeholders and valuing their opinion and how it affects not only them, but then the people who actually the mandates apply to, not just us who are sitting here saying you should do this, you should do that, but the people who actually have to implement it and live by it. It's important to get their feedback as well.
And look, I spread that misinformation, right? I put up that slide. That slide says, if you look on the website, from KSI.
Yeah.
It didn't, that country, I mean, our country, that country,
Yeah.
that country, I don't recognize the country, it has from KSI website. And, when I called Doug Costa and I said, Doug, you formed this coalition. I said, how come you didn't think about, listen, I'm all about too, like women's sports, right? I'm like, how come you didn't think about the other groups? He goes, listen, Cindy, they just asked me if KSI want to be part of it. And I'm like, sure. I didn't ask who else was going to be part of it, but exactly right. It was started as a PR. Let's get all the major leagues. Their mindset is major leagues. It's always been the men's leagues. I get it. They've been around longer, right? Let's get the men's leagues. And actually at MLS, because they're the outlier. They haven't been around as long, but they're a men's league, right? Men's professional league. But yeah, they are. I mean, Brian could probably, as Brian, you have to be more political than me, obviously, when you speak on this, but you've been part of almost every single meeting that they've held. And sometimes I will get sidebars. I've made friends now through being on this coalition because I worked very closely with them for the Fan Fest for our championship game. And I have heard backstories that you wouldn't believe. And I'm like, wow, and it's just, where it is all PR, they just want photo shoots. They go into the office, they're going to do a photo shoot. It's going to be put on the website, that type of thing, and I don't think that's necessarily 100% true. But sometimes it seems like we're spinning our wheels, this coalition. And I think it's being driven really by the individual stakeholders.
Cindy raises a good point, though, that, I think that the lack of attention to female sport professional organizations really does present an opportunity for a group like AMSSM to come in and build coalitions with these groups that are meaningful and not distorted by a lot of maybe economic factors. And so kudos to you, but keep going, because I think we're on the cusp of a women's professional sport boom. The volleyball league is getting ready to get going, and Caitlin Clark's about to turn pro, and you've got 90,000 people filling Memorial Stadium in Lincoln for a volleyball game. Now's the time to be talking to these organizations. So I'd encourage you to continue down that route.
Well, we in the ice hockey league, and I would just tell you as an aside, we have formed because we were not invited to join the CMO men's league group. Select that carefully. We are forming our own women's professional athletes teams group with the WTA and the national or the internet, let's see, professional women's hockey league, NWSL, WNBA. So we will be forming our own coalition to bring forth issues. You know, since we're always an afterthought, or it takes phone calls from Cindy and emails from Cindy to say, hey guys. So anyway, it's good, right?
That's awesome.
But yeah, Brian's awesome though.
uh,
Brian's represented us every meeting. So thanks, Brian.
Yes, Brian is the man. So Cynthia had to unfortunately drop off. So on behalf of Cynthia and Brian and the whole committee, I just want to thank our 4 speakers tonight. Y'all are awesome and great presentations and amazing work that you're doing in your community. So thank you for all that. And if there's any other questions, I'm sure they'd be happy to take it offline. And again, thank you, and we'll see y'all soon.
Good seeing everyone.
Thank you. Take care.
A good one.